So now, if you want to be interpreting radiographs, that's like I've imaged the patient. So as I've imaged the patient, I've gotten the image. So what are the basic what techniques I can use and be able to always now say what this particular image, like what disease condition is here. You understand? So identifying radiographs is actually a very important step in radiography. Why? Because you might end up imaging, but if you're not able to interpret it, the whole reason for the imaging is actually what conquered. Do you understand? So patient information and marking is first you have to identify the patient. You have to identify the date which that imaging was done. You have to know the age and the sex of the patient. So anatomical markers, you have to know if it was the right side or the left side of the imaging. That's the first step towards good interpretation. So other positional markers, you have to now know if the patient was facing up or down, erect or decubitous, and all of that, you know. So radiographer identification, initials or code. Radiographers often add their initials or staff code, you know, department details, and technical data as you are trying to look at how much was the exposure, you know, the examination type. You're trying to look at what part of the body was actually imaged, you know. So digital radiography metadata in modern systems, DCOMS tags are automatically store patient demographics, exam details, and acquisition parameter. Then quality control checks. This is when you now verify before the exposure. You confirm the patient identity is actually verbal, you know. Then okay, basically, right? Avoid duplication. So each radiograph must be uniquely identifiable to prevent confusion with reporting. Okay, so these are the various techniques that you take in trying to identify radiographs.